Hi everyone, today I'm going to explain endodontics diagnosis. Dental pain may originate from pulpal or periradicular tissue. Pulpal pain is of threshold type, that is, no response occurs until threshold level is increased. In healthy pulp, sensitivity produced by cold and warm stimuli lasts for 1 to 2 seconds. Periodontal pain is deep somatic pain of the musculoskeletal type. This localization can be identified by applying pressure to tooth axially and laterally. Pulpal diagnosis are normal pulp, reversible pulpitis, irreversible pulpitis, necrotic pulp, previously treated pulp. Periodontal diagnosis are normal apical tissues, symptomatic apical periodontitis, asymptomatic apical periodontitis, acute apical abscess, chronic apical abscess. In normal or healthy pulp, when we using cold test with endofrost, patient feel cold for 1 to 2 seconds and pain goes away quickly. You can see the radiograph of a healthy pulp here. In reversible pulpitis, short and sharp pain occurs that lasts only when stimuli is applied. Short and sharp pain disappears on removal of stimuli. Pain is usually caused by cold, sweet, or sour things. Since pulp is especially sensitive to cold stimuli, cold test is best method to diagnose the case. Removal of the cause, if present, such as caries or fractured restoration, will treat the tooth pain. Irreversible pulpitis develops if inflammatory process progresses to involve pulp. Patient may have history of spontaneous pain or exaggerated response to hot or cold that lingers even after the stimulus is removed. The involved tooth usually presents an extensive restoration or caries. Patient need endodontics treatment. Here is X-ray. Pulp necrosis. It results from continued degeneration of an acutely inflamed pulp. It is frequently associated with apical radiolucent lesion. Tooth is usually asymptomatic, may give moderate to severe pain on biting pressure. Pulp tests show negative response. Crown discoloration may happen. Treatment is complete removal of pulpal tissue that is root canal. Normal apical tissue are asymptomatic. Percussion, palpation, and X-ray are main testing for apical diagnosis. Percussion is tapping on teeth with mirror handle. Palpation is feeling on gum with gloved finger around the apex of the root. Patient shouldn't feel any pain. Symptomatic apical periodontitis is the inflammation of periodontal ligament, which is caused by tissue damage, extension of pulpal pathology, or occlusal trauma. Patient has moderate to severe pain on percussion. Pulp tests are essential, and their results must be correlated with other diagnostic information in order to determine if inflammation is of pulpal origin or from occlusal trauma. Diagraphs may show no change or widening of periodontal ligament space in some cases. Treatment is complete removal of pulpar occlusal adjustment. Acute periapical abscess is an acute inflammation of periapical tissue characterized by localized accumulation of pus at the apex of a tooth. Patients usually relate previous painful episode from irreversible pulpitis or necrotic pulp. Swelling, tooth mobility, and fever are seen in advanced cases. Spontaneous, dull, throbbing, or persistent pain is present. Tooth is extremely sensitive to percussion. Mobility may be present on palpation. Tooth may be sensitive. Vestibular or facial swelling is seen in these patients. Pulp tests show negative results. Treatment is drainage and complete extirpation of pulp, appropriate analgesics and antibiotics if necessary. Chronic apical abscess is caused by necrotic pulp, which results from prolonged inflammation that erodes the cortical plate, making a periapical lesion visible on the radiograph. It is usually asymptomatic. Pulp tests show non-vital pulp. There is no pain on percussion. Radiographically, it is usually associated with periradicular radiolucent changes. Thank you for watching.